Welcome to today's lesson on pediatric pulmonology. Our focus will be on bronchial atresia, a rare lung condition often discovered by chance during chest X-rays in older children or adults. We will explore significant points through 5 carefully crafted questions and answers to enhance our understanding of this condition. Question 1. Is bronchial atresia typically associated with infections? The answer is no. Infections are not commonly associated with bronchial atresia. Since the condition lacks communication with the normal tracheobronchial tree, it typically prevents the entry of pathogens that might lead to infections. Is surgical intervention always required for treating bronchial atresia? The answer is no. Surgery isn't always necessary for bronchial atresia. It is typically recommended only for cases where the lesions cause symptoms, as most patients remain asymptomatic and can be managed without surgical procedures. Question 3. Does bronchial atresia typically present as hyperinflated on chest radiographs? The answer is yes. Bronchial atresia typically manifests as a hyperinflated or hyperlucent region on chest radiographs. This hyperinflation results from unidirectional airflow through collateral airways such as the pores of Kohn and canals of Lambert. Question 4. Is there a definitive explanation for why bronchial atresia predominantly affects the left side? The answer is no. There is currently no known explanation for why bronchial atresia tends to occur more frequently on the left side. Although this pattern has been observed, the precise reasons remain undetermined by researchers. Question 5. Can bronchial atresia be associated with other congenital malformations? Answer 5. Absolutely yes. Bronchial atresia may represent a common pathogenic pathway. 4. The answer is absolutely yes. Bronchial atresia might be linked to several congenital lung malformations. It is thought to share a common pathogenic pathway with conditions like intralobar sequestration, congenital cystic adenomatoid malformation, and congenital lobar emphysema, as indicated by similar histopathologic findings. In conclusion, today's discussion underscores the complex nature of bronchial atresia, emphasizing its diagnostic and therapeutic considerations, typical radiographic features, and its potential role in other congenital lung conditions. By understanding these aspects, healthcare professionals can enhance their clinical approach to managing and researching this rare condition. Stay tuned.